Hi, good evening, and welcome to Managing Your Benefits with Molly Jones. How is everybody doing this evening? Well, guess what? We have a great show for you. So I'm going to give everybody a few minutes to come on in, And when you get in, just say hello, hello, and let me know you're here. Yes, yes, yes. This is going to be a lively evening. So I hope everybody is ready to get started. We do. I'm going to tell you a little bit about me. I am Melissa Mully Tabor, and my professional career has been in healthcare, primarily in revenue cycle. And with revenue cycle, pretty much that's billing claims and all of that good kinds of stuff. Anything that has to do with your health insurance, your electronic medical records, that's what I have been working in over the course of my whole career. So I'm here to help you make Medicare make sense. So tonight we are going to be talking about something real simple. We are going to be talking about Medicare, right? The types of Medicare and their differences. Now, what a lot of people don't realize is there are various types of Medicare and they extreme all across the different kinds of ways, right? So most people there's just basic Medicare, but there are three different kinds of Medicare. And as we get later on into that, we're going to talk about that. But before we get into the who, what, when, where, how about Medicare, their types and their differences, let's just talk about the basics, right? What is original Medicare? All right. I'm going to give y'all a little history lesson because y'all know I'm all about the education, right? So I'm going to give y'all a little history first before we get into the topic of discussion. Medicare, that's a federally funded insurance for anyone 65 and older and some people under 65 with certain disabilities or conditions. So, what type of conditions under 65 would it cover or disabilities? One of the most common ones is end-stage renal disease. That's people who are having trouble with their kidneys, all those different kinds of things. They go to dialysis. Well, those people also qualify. And there's some other disabilities, such you might get something amputated or cut off, you lost a leg or a physical limb that you can't work. Those are the different kinds of disabilities that they're looking at. Now, Medicare, when you reach a certain age, is the most common one that we see, right? And so the very first thing I'm going to talk about, and I'm going to try not to go through too fast, but the very first thing we're going to talk about, what is the biggest mistake with Medicare, right? Because we know everything, they have their pros and their cons. But let's start simple. What is the biggest mistakes with Medicare, right? And the number one most often mistake made with Medicare is people miss their initial enrollment period. So what that means is when it's time for you, when you reach that retirement and you're 65 and now you're ready to get your Medicare benefits, there is a certain time between the time you retire, ladies and gentlemen, and the time you are eligible or have to apply, or a window that you have to actually apply for those Medicare benefits. And if you don't apply when that window is open during your issue coming to the end of your work, then what's going to have to happen is you're going to have to wait until open enrollment comes out again. Okay? Then you'll be able to apply for it. Another common mistake is people sign up for the wrong coverage, right? I mean, it's just human error. You go to the grocery store, you think you bought white eggs, but when you get home, it's brown eggs. It's just you're selecting the wrong kind of coverage that you need. And we're going to get into the various coverage types a little bit later. And then the next thing is making an assumption that because you're covered and your spouse turns 65 and they will automatically be covered too. No. It doesn't work like that, ladies and gentlemen. So one thing we have to really be mindful of, when do I really become eligible and when does my window open to apply? Now, when you're retiring from your job or your employer, they should be calling you into your office and having some type of conversation with you and giving you the different packets for the different fits that you're entitled to once you retire. Okay. And one of those items are Medicare. So you should be receiving that information during your retirement plan. Okay. Now that we know that when it come from and how old you are, the biggest mistakes. Now, next thing, let's talk about some fun stuff now. Did you all know there are 3 types of Medicare? Yes, ladies and gentlemen, there are 3 types of Medicare. And the first one that everybody knows about, that was developed back in the early 60s, FDR administration, all of that, that is the original, the one and only, the original Medicare, where you used to get your little red, white, and blue cards. Well, they changed your red, white, and blue cards, so they're not red, white, and blue anymore. They're now a little plastic card that looks like any other insurance card. And when original Medicare first came out, there's your social security number and the letter at the end. Now, ladies and gentlemen, that letter at the end in the beginning, that told how you were receiving your benefits. So if you had your social security number on your old red, white, and blue card and it had the letter A at the end, that means you were receiving your own Medicare benefits. Where it be at the end, that means you're receiving your spouse's benefits, right? So that is just basic, original Medicare, and now they changed it. And so now that nomenclature that we're used to in old school, that's completely gone away with the new claim, the new numbering schema they have. The second type of Medicare that is so interesting that a lot of people were not aware of is called railroad retirement. Yes, railroad retirement for railroad employees. And then the third type and final type of Medicare that we have today right now, unless they come up with a new one, is the Advantage plans. So if you have Medicare, then you're going to fall into one of these 3 categories already. If you're close in that age to Medicare, then one of these criteria are going to come into play for you. But number 2, only if you qualified because you were a railroad retiree. So then you ask me, what is the big difference between these different types of Medicare, right? Let's talk about it. What's the difference between the type? Number 1, original Medicare, ladies and gentlemen, that's for most people. So when you reach the age of retirement, ladies and gentlemen, or you have a disability, like I talked about earlier, such as renal failure, chronic renal diseases, or you are a disability, such as my brother was. He was blind, and at a certain age, he qualified for it, right? And so that's original Medicare that most people have, that most people know about. Now, the second type of Medicare that most people don't know about, because, hey, let's be honest, most of us aren't railroad entire employees, so we wouldn't know about this benefit. But there is also called railroad retirement, and that's specifically for those retired employees of the railroad, right? I don't know if it's transcontinental or whatever the various railroads they have. Well, they have their own retirement plans and system that functions and operate just like the original Medicare, okay? Then we have the third, the latest and the greatest that has come on, Advantage plan. Advantage plan, just like original Medicare plan, most people can have that. So at the end of the day, when it's time for you to decide to get your Medicare, you'll have 2 options. Option 1, original Medicare, or option 3, the Advantage plan, because option 2 is only for railroad retirees. So I know you're saying, well, Melissa, if it's for only railroads, why are you telling us about this? Because it's a form of Medicare. And that's what our conversation is about tonight. The various type of Medicare, their benefits, and how they work. Okay? Now, so as we're going through these various conversations tonight, this is going to be a lot of fun, right? A lot of fun. So let's talk about original Medicare for a second, right? Original Medicare, what we know. Original Medicare has Part A and Part B. We already know that. Everybody knows that famous stuff. Medicare Part A, inpatient care. Part B is outpatient care. So we already know A covers inpatient, B covers outpatient. Plain and simple, cut and dry. We're going to get into the different things of inpatient a little bit further as we go along into the discussion. We'll go talk about that a little bit more. Okay? Now, excuse me, railroad retirement. Remember, I told you, ladies and gentlemen, that railroad retirement functions just like traditional Medicare? Well, true statement, because they also have those same part, inpatient for Part A, and Part B covers outpatient care, right? Plain and simple, cut and dry, to the chase. That's it in a nutshell. Now, the last one that we have, ladies and gentlemen, is, guess what? The Advantage Plan, aka Part C, and it varies by zip code. Okay. Now, the additional thing, Advantage plans, they do Part A and Part B, but they have some extra features in there that they cover, which is one of the key reasons most people switch over to Medicare Part D, is for the medication coverage, because the traditional Medicare doesn't have medication coverage. So a lot of people will swap over to Part C, those Advantage plan for that, right? So now that we know we have our three types, we have our original Medicare, we have our railroad retirement, and we have our Advantage plans, right? So, and they all have Part A, Part B. But before we go into the details in the weeds, or the fun that I like to call it, let's talk about what each one of those covers, because it's all well fine to have it, but if you don't know what it covers, then you're still going to be at a loss, because you need to understand the why behind the why, right? So let's talk about what part first, right? Plain and simple. Part A is going to cover your inpatient hospital, your skilled nursing facility. So I'm going to pause right there for a second. What is skilled nursing facility? So let's just say you're on Medicare and you had a total hip replacement and you needed rehab, inpatient rehab, which is skilled nursing facility. We have some of those here, such like Memphis Jewish Home, or you have Methodist Encompass Health Rehabilitation Center, those different kinds of things where you can go and you can actually get the rehabilitation that you need, and then you go home, which is a totally different type of care, of medical care. Okay. It also covers hospice. Unfortunately, we all know what hospice is, right? And that's when you're nearing the end of life and they're covering some service for you. And depending on when you're inpatient, certain lab tests will apply while you're inpatient. Okay. It also covers surgery. So if you need something done and you need some surgery, and that doctor told you need an appendectomy or you needed a knee replacement, let's use a knee replacement, perfect example. You can go and you can have your surgery done. They'll cover your inpatient surgery. And after that, they say you need rehab. You can go to the skilled nursing rehab and you can get your rehab done. Come on home. Now, keeping in mind, you will, of course, have to pay the appropriate copays and deductibles. I don't want to make it seem like you go in there and they're going to pay everything at 100%. No, copays and deductibles, that's going to be Medicare 202. This week, we're just talking about Medicare. This week, we're just talking about Medicare 101. Okay. Now, let's talk about what Part B covers, right? Now, remember, All of them have this, right? But this is just some of the things that they cover. Our Medicare Part B, ladies and gentlemen, that's going to cover your outpatient diagnostic care and services, right? So it'll cover your doctor visits, your x-rays, your lab, your physical therapy, your speech therapy, all of those different kinds of things that you need to make sure you maintain your well-being. Okay? But there's a catch to this. With these lab tests and x-rays, there's a trick to that, because Medicare says Medicare is just not going to pay for something and let doctors run your insurance up and all the stuff, all kind of willy-nilly kind of stuff, because Medicare has a rule in place. Before any outpatient diagnostic lab or radiology is performed, where you are aware they have to meet a certain criteria, meaning the diagnosis have to justify the test. So if a doctor's order EKG on you, right, he has to give the appropriate, I'm sorry, EKG is not a good test. Doctor ordered a CBC on you, he has to have a valid diagnosis of why he wants that blood when he sends it to Medicare, because Medicare is in the mindset it has to be what's called medically necessary. Medically necessary, Medicare will not cover those outpatient tests. So what happens is when you're having those outpatient tests, ladies and gentlemen, prior to receiving those tests or having those tests performed, you should be completing what's called the ABN, Advanced Beneficiary Notice, right? And what that is, ladies and gentlemen, that's a document that the physician's office runs to determine whether or not Medicare will cover that test. Yes, that's exactly what I said. Prior to having those tests done, they can tell you right then and there whether or not Medicare will likely pay for the test. Now, when those physicians run those ABNs, ladies and gentlemen, if it fails Medicare's medical necessity, the physician must tell you, okay? And at that point, you have a decision to make, because you're now being informed Medicare will not pay for this. Do you still want to have this test done? Yes or not? So yes or no. So if you're receiving Medicare benefits and you're having these outpatient testing done, these lab and these tests done, x-rays, make sure, ladies and gentlemen, that they are completing those ABNs on you. Now, that does not apply in the ER, because we know ER is outpatient as well, but the ABN rule does not, Advanced Beneficiary Notice rule does not apply in the emergency room. All right. I hope y'all learning something. I am just having so much fun talking about this. Okay. Last one we have here is Part D. Okay. Covers medication. That is Advantage plans only. There are no other plans, ladies and gentlemen, that covers medication except the Advantage plans. That's the only one. Now, you may have a supplement, a secondary. You may have your TennCare secondary. You may have a Blue Cross secondary, or whatever you have secondary. Now, in those instances, those may generally cover your pharmacy or your medications, which is going to be our topic next week. We're going to be talking about benefits and how they really work, right? So we'll be talking about pharmacy next week. And Medicare only covers that with the Advantage plans, okay? So now let's get into some real fun differences. The first one of the big differences is the management. Who's minding the mint, as they say, right? Well, Medicare is run by the Healthcare Financing Agency. That's just the big old way to say the government is running Medicare. We know it's always, because it's always out there. You're always seeing it. It's always in Congress. The first thing when they want to cut something, the first thing that they want to cut is Medicare. You know what? I'm going to need y'all to cut something else. I'm going to need y'all to cut something else besides Medicare, because people have worked hard all of their lives. They paid into this. They paid their tax dollars, and they are due these benefits that they worked so hard to receive. people are now trying to cut them and take them away. Just a side note, it's election time, so make sure y'all stay on up and vote. And think about when you vote, who's trying to cut your Medicare? Think about that. Who's trying to take away your benefits? Because this is important. This is life-saving benefits. Railroad retirement, of course, that's a no-brainer. That's a given, ladies and gentlemen. That is administered by the Railroad Retirement for their employees and their employees only, and the spouses and children as appropriate of those railroad retirees. And then the last one, the Advantage, that's a plain, no simple commercial plan that operates partially somewhere between a HMO and a PPO. They're somewhere in between there. HMO is a health organization where you have to go through your primary care physician for all services. And if you don't use your primary care physician, they can, in some instances, deny your claim, because with health maintenance organization, as I said, your primary care is your gatekeeper for your care, and everything has to roll through them. And in some instances, you have some Advantage plans functions or operate as a PPO, a preferred provider organization, which means you doesn't follow the same principles as an HMO. This one is not as strict and not as lean, as firm as a HMO. It has a little to lean. It says preferred provider, which means they have a group of providers, ladies and gentlemen, that they will prefer you go to. However, if the need arises and you have to go out network, then what can happen is they will cover. Unlike if you're in an HMO, and I bet you United Healthcare is the HMO. That's the ones that's really, really, really stricter on following that, right? So just remember that Medicare is ran by federal government, railroad retirement by the retirement agency, and then the Advantage plan, that's a commercial plan operating as a PPO or HMO, and that's just big dollars, make money, okay? Now, when there's differences, guess what? There's always a difference in cost. Nothing costs the same. Nothing costs the same, right? So let's talk about what it costs, right? Because each one, ladies and gentlemen, has its own separate costs. Part A, your in-care care, or your skilled nursing, your hospice, your home health. For most people, the cost for that is zero for most people. There are a few instances when you have to pay for Part A. Now, I've been around doing healthcare billing for quite a few years now, and I cannot say I've ran across anyone that actually had to pay for Medicare Part A. I just cannot recall. But if you're out there, Facebook land or any land you're in and you're paying something for Medicare Part A, shoot me an email and let me know what's your geographical region, because I'd like to find out some information on that. Now, Medicare Part B, your outpatient, your diagnostic, that's on average about $175 a month, right? Then your Medicare Part C or your Advantage plan, ladies and gentlemen, that's running on an average $0 to $200 a month. You say, well, why is traditional Medicare or the other ones are a solid dollar amount? However, Part C has a range, because with theirs, they have additional services that you can and cannot purchase, right? So that's what's going to lend to the flexibility of whether or not your Medicare Part C. Because if we could look at that, that's a big old range from $0 to $200. Now, keep in mind, you're still going to have to pay your deductible, your Part A, you're still going to have to pay your Part B. But what happens is when you're in that Part C, that one big old $200 that you're paying is going to pick up your Part A, your Part B. It's going to pick up all of that. So the real question becomes If you're considering Part C, one of the Advantage plans, you really need to look at the weeds in the details about what is the difference between the plans and a variation in the rates, because that is what's going to make a big difference. That's going to make a big difference, ladies and gentlemen. I mean, greater than you know. Now, next thing is, what's the coverage difference? Plain and simple, easy enough. Original Medicare and railroad retirement, it covers everywhere you go. You just have your insurance card, you go on, you do what you need to do. Now, the Advantage plans, that's where you get the fork in the road, because, ladies and gentlemen, the Advantage plan, that varies by zip code. So essentially, plans can be in the north, that's not in the south. Plans could be in the east, that's not in the west. They could be all over the place, because the Advantage plan, ladies and gentlemen, those those vary by zip code. So not every plan is in every state, because they have to go through a certain regulatory process to get licensing in each state. Now, I don't know if there's a max that the Advantage plans can do in states at 50, maybe 25 states. I don't know. But I do know they vary by state and by zip code. Okay? Now, what's the difference in benefits? This is the icing on the cake for the Advantage plans. This is the icing on the cake for the Advantage plans. Because the Advantage plans, ladies and gentlemen, they have some things that traditional Medicare does not have. The Advantage plans has additional benefits such as medication coverage, dental, vision, and hearing services, right? That's exactly right. Dental, vision, and hearing. And that is the most common complaints, ladies and gentlemen, that I have heard over the course of my professional career with healthcare, is that Medicare does not, because Medicare does not cover the dental and vision. Really hard on a lot of elders that really need those benefits, because everybody knows your vision changes from year to year. If you don't know, there's something called age-related macular degeneration, which means the macula in your eye gets older and older every year. Because you notice, guess what? You're going to look at your eyeglasses getting close to your birthday. Check and see if your eyes are changing or if your vision is changing. Yes, ladies and gentlemen, it may not change before your birthday, but a little bit after your birthday, it'll begin to change. And one thing I want you to know, the older you get, the more you will notice the changes in your vision. So, having that's just one perk of the Advantage plan. Dental, right? Once again, seniors need a lot of dental services. I'm not a pro or con. It doesn't matter what you do. My brother, just because of his medical needs, the Advantage plan is working for him in his state right now, because he needs some dental services done. So it's a perfect world for him, right? But let's talk about my situation, because everybody is different, because everything is cost related, right? And I'm going to talk about that right now. Which plan is for you? How do you know which plan do you get? Do I go with traditional Medicare, or do I go with a Medicare Advantage plan? You really have to think about this. Let's look at a couple scenarios, okay? I'm going to use my scenario as an example, okay? Everybody know Andrew retired, right? Yeah, he retired. So he became eligible for Medicare. So he option traditional Medicare or Medicare Advantage. Stay with me, ladies and gentlemen, because this is getting ready to get deep. Cost effective wise, it makes sense for Andrew to use traditional Medicare. Why, you say? Advantage plan has all those other things, vision and hearing. Hold on, ladies and gentlemen, let me finish. I am working, right? And guess what? Yes, sir, y'all connecting those dots. I have insurance on my job. So what I did was I covered Andrew on my job, which makes his Medicare secondary. So all of those extra stuff that he would have been paying for, the dental, the vision, and all, he doesn't need that because I'm still working and I have the insurance in our job. So he's getting all of that through a job. So if you're ready to retire and you're ready to get Medicare, but you have a spouse that's still working, stay with me if you will, you all may want to consider and look at the cost analysis. It just makes sense for me to put you on my plan at work and you get regular Medicare and everything else is covered and you can save some money, right? That's the next thing, right? Now, the second thing is the Advantage plan. Tell you what, if you have a secondary, you might not need an Advantage plan. You might not need an Advantage plan if you have a secondary. Because guess why, ladies and gentlemen? You got it. Your secondary benefits, in most cases, will cover, in some instances, depending on your policy, will cover your medications. And in the state of Tennessee, ladies and gentlemen, if you have TennCare as a secondary, in most cases, depending on what's going on, it will cover the cost of your medications as well. So there it is with the regular Medicare and working with a supplement. That may be all you need because your secondary, your supplement may provide those same benefits that the Medicare Advantage plan does as well. So if you don't have a secondary, ladies and gentlemen, you may want to consider getting yourself a secondary plan that may even be cheaper than the cost of the Medicare Advantage plan. Just paying the cost of your traditional Medicare in the secondary, you may still come out less and that you need. Now, on the flip side of that, the next question becomes, Melissa, you telling me don't get the Advantage plan? No, I'm not telling you don't get the Advantage plan. What I'm saying, ladies and gentlemen, is those are the scenarios that you would want to consider to determine if traditional Medicare is for you. We're looking at the cost analysis. Same thing with the Advantage plan. But in the Advantage plan, this is a no-brainer. It's straight cut and dry. If both Andrew and I were retired, there's a great likelihood, not guaranteed, but there's a great likelihood on the iffy side, we may go with the Advantage plan. That is strictly contingent upon the Advantage plans that are available in our zip code, okay? I can tell you which Advantage plans I would not go with. This is Melissa speaking for Melissa only, based upon her experiences. I would not go with United Healthcare. I just don't like United Healthcare. When I had my own billing service, United Healthcare, they were hard to get authorizations from. They didn't pay their claims. It's just a long stretch of things, of reasons why I don't like United Healthcare. Melissa, this is just Melissa preference. And also, United Healthcare has a tendency to function like, in some instances, in some states, function like a HMO. And I don't want to deal with an HMO. I don't want the doctor to dictate to me or the plan dictate to me who and which doctors I can go to. I would prefer to be somewhere that has a preferred provider network, such as Humana or Cigna, if it's in your state. So you asking me what's my favorite? The best one of all that I think, I got two, the best pros and cons. My better one I would go with, if we had to go with one, Melissa, will go with the Humana plan. Why? Based upon experience with processing claims, because remember, I had my own claims processing service, so I'm very familiar with how the whole benefits work, from the front end to the back end, from the beginning, pre-admit, denials, claims, all of that. And in my experience, Humana and Cigna were the top two that provided quality benefits that's easy to understand and you can use, right? So when my family and my friends ask about, Melissa, which one you going to go with? The first thing I'm going to say is I will go with Humana if it's in your zip code. I would not go with United Healthcare that's in your zip code. There's a couple of other ones. Well, this one and that one, I can't speak to those ones, but there are a couple of other ones out there. I'm not going to call their names because my experience, I'm going to say this. If I have a hard time just connecting with the provider person, then I can imagine what the patient going to go through trying to get a doctor. There are so many variations of things. I'm not going to go on a tangent like I can or like I do. So I see we got a few viewers out there. Thank you for joining this evening. Please drop something in the chat. Let me know what you're thinking about. How's the conversation going? Tell me something. Talk to me. Let me know what you're thinking about this. Any questions? Because I just don't want to be a little robot and just running on and just chitter-chatting, Go ahead put your question in chat. I would love to talk about this and hear what you are thinking about this, right? Because Medicare is no joke, right? And guess what? It's election time and things are going to change, right? We don't know what's going to continue to go on or how they're going to end up. But what we do know is we have to be mindful of our benefits and how we use them. Because if we are not careful, we will pay for something, ladies and gentlemen. You will end up paying for something that you don't need, or paying for something you didn't realize you were paying for, and it's costing you an arm and a leg, or you're just going to be letting benefits go to waste that you're not using them. Go out, research. Now that you know, take 2 steps back. Go on and look at see covers what, because it's a lot of information out here and it's a lot of different things that you all need to be mindful of. But what we really want to make sure that everybody understands is that, hold on. Make sure that everybody understands is exactly what covers what. Part A covers your inpatient. Part B covers your outpatient and diagnostics. Part D, ladies and gentlemen, covers your medications. But Part D, guess what? Advantage plans only, right? So what plan is for you? Stop, think, process, determine what you need and how you can use it best. You have any questions, any concerns, you can always send me an email, information@mycommunityhealth.org. That's all for today, ladies and gentlemen. I hope you enjoy it. Join me next Wednesday night at 8:30. We're going to be talking about those pharmacy benefits. And so I know everybody has questions about those pharmacy benefits and how they're going to work, right? Yes. Interestingly enough, we'll be talking about pharmacy benefits, insulin, the shots, what's covered, is covered, and all of those different stuff. So again, ladies and gentlemen, this has been fun. I want to thank you for joining me. This afternoon. And as I said, if you have any questions, I'm Melissa Mully-Tabor at Managing Your Healthcare Benefits. Drop us a line. Otherwise, we'll see you next week. Bye. Stay healthy. And remember this, Why have benefits if you're not going to use it? Peace.